The new epidemiological shift of the at-risk population has led to new knowledge gaps. Only since 2005 has the CDC requested state health departments to report the sex of the sex partners of individuals with syphilis. Although the information is being reported at higher rates with each passing year, there are still reporting gaps from the states. For example, in 2013, only 49 states provided their total amount of syphilis cases, and of the reported male cases, only 83% had information regarding their sexual partners. Even with this information missing, it is widely known to public health officials that there is an increase in syphilis cases, and the majority of these new cases are among men who have sex with men. But the general public is still widely unaware of the rising cases among the gay and bisexual community. The Healthy Penis campaign was created by the San Francisco Department of Public Health with the primary objectives of increasing testing and awareness of the growing syphilis rates among the gay and bisexual community, and to increase knowledge of symptoms. The campaign was meant to be sex positive and not focused on changing individual sexual behaviors in order to reduce syphilis rates. The campaign used a mixed social marketing method to promote knowledge and testing. This included comic strips, posters, online ads, a website, and a hotline. Focus groups and the population favored the campaign because it was sex positive, humorous, and informative. Data was collected by conducting interview surveys of a random sample of local men between the ages of 18 and 60. The majority, roughly 80% of the men, were aware of the Healthy Penis campaign, and a large portion of those had gotten tested for syphilis within 6 months of the survey. Those aware of the campaign were also more knowledgeable about symptoms and had not changed their sexual behavior. This is an example of a comic strip created for the campaign. In it, we see Clark, Byron, and Pedro, the three protagonists who represent different ethnic groups. The campaign focused on items of interest to the target population, such as pride, or were set in areas frequented by them. In this comic strip regarding pride, they discussed the increasing rates of syphilis, promoted testing, gave information regarding how often to get tested, and their website where individuals could get more information and find testing facilities. These comics successfully gave accurate information in an entertaining and humorous manner. A shortcoming of this research was the small representation of the Black population. When conducting the surveys, the majority of participants were white, 64% versus 4% African American. The sample did not accurately represent the syphilis population. As previously stated, the rate of syphilis for African Americans is 5.6% higher than the rates for whites, which means that the study cannot be generalized onto the population. There is a significant increase of efforts to reduce the rates of syphilis across the country, with an emphasis on the gay and bisexual population. If given the opportunity, our research team will be able to put our vast knowledge of the disease, its distribution, and needs of the population to assess and develop a campaign using new research methods. Previous research found that using a humorous mixed social marketing campaign can increase syphilis testing, knowledge, and awareness, but it has not been tested thoroughly enough to prove that this type of campaign can be successful in different minority groups or the country as a whole. We will model a campaign after the research done by Montoya and improve upon it to more accurately represent the racial distribution of the syphilis population and provide additional outreach to specific subgroups through community-based participatory research, which is an alliance between community organizations and research units in order to investigate health-related issues of interest to the community. We will increase the sample size by using the campaign in multiple cities simultaneously, and we plan to analyze the information differently from past research by comparing the rates of testing, knowledge, and awareness of syphilis across certain racial and ethnic groups, age, socioeconomic status, and lastly assess whether the same campaign can be successful throughout the country. The determinants that we identified through our research provide the roadmap for eradicating a disease in the U.S. that has affected human lives for 7 centuries. Syphilis is a disease on the brink of elimination. The time to invest and achieve success with syphilis is now.